Hello everyone, Assalamu alaikum, good afternoon. This is Dr. Salauddin, pulmonologist from Government General and Chest Hospital. I practice at healthcare clinic Manikonda. So today I'll be talking about this Omicron regarding the upcoming third wave. As you all know, like previously last year we saw COVID, it wreaked havoc. There were a huge number of deaths across India, across worldwide. So there are a number of questions coming regarding this third wave. People are in confusion. So I'll try to clear those misconceptions and doubts today. So first one, is this wave going to be severe? So the answer is we don't know. So because data from the other countries, it suggests that this wave was less severe. The number of infections were more, but number of hospitalizations and deaths were less compared to other strains. But this can't be generalized because the demographics are different. India, we have a huge chunk of young population, people living with comorbidities, unvaccinated people, elderly people. So we all know we can't expect COVID appropriate behavior in our country. So this equation can't be generalized. So regarding other countries, this wave was less severe, number of hospitalizations were less, number of deaths were less compared to second and first wave. But recent data suggests that in our country itself, from Bombay, Delhi, so the severity is enough in unvaccinated and again in people living with comorbidities, especially elderly people. So recently there was a report that in Bombay, 96% of the admissions were in the unvaccinated people. So all those people who are still unvaccinated, who have still doubts regarding vaccination, please get vaccinated, because vaccine, again, there are really so many misconceptions about this vaccine. So vaccine won't prevent you from infection. So we will be having further waves due to emerging of further strains. So it won't prevent you from infection, but definitely vaccine will prevent you from severe form of disease, from getting hospitalized, from death. Kindly people get vaccinated. So, and second thing, what are the symptoms in this that are going to be appearing in this wave regarding the Omicron? So Omicron itself is not dangerous. Like data suggests it's more of upper respiratory symptoms: cold, nasal discharge, throat pain, and back pain sometimes. So whenever you have lower respiratory symptoms like cough, severe cough, myalgias, fever, prolonged fever with myalgias, or breathlessness, and when your pulse oximeter shows drop in saturation, hypoxia, so particularly this can happen in Omicron, especially in people living with comorbidities like diabetes, hypertension, liver diseases, heart diseases, or in unvaccinated people. As such, Omicron is relatively safe. So if at all, if a person has all these symptoms, if the severe enough symptoms, then we should be thinking of on the lines of secondary infections, or it can be coexisting Delta variant also. So there is a recent report suggests that there is a variant known as Delta Cron or Florona. So all these possibilities should be kept in mind. So how to detect this? So usually RT-PCR is good enough to detect this COVID. So regarding Omicron, so if the lab you're getting tested, if it employs this S gene, then it is easier to delete. That will detect your Omicron variant. So, but not all the labs are employing this S gene. And recently, Tata has come up with a new kit, 𝗀𝗍𝗺, which detects only this S gene. So that is specific for 𝗀𝗍𝗺. So if at all, if your RT-PCR report is positive and if you have more of upper respiratory symptoms, then get isolated and don't go for unnecessary testings. Kindly consult a doctor, because not everyone needs all those D-dimer levels, IL-6 levels, and serum ferritin, whatever you are getting. So not everyone will need those testing. So please kindly consult your doctor if required. If people in elderly age group, unvaccinated, if people are having prolonged symptoms, then your doctor will order these investigations. Kindly don't get all these baseline investigations on the first day itself. And regarding treatment, again there is a lot of confusion going on regarding treatment. So people are crazy about this cocktail regimen. So one thing I want to make clear, if the variant is 𝗀𝗎𝗺, then the cocktail won't work. The cocktail was for previous variants, the Delta and other variants. So cocktail won't work in Omicron. So we have other drugs like 𝗶𝗰𝗹𝗂𝗱 and sotrovimab, which are still unavailable in India except for some higher centers. And molnupiravir, again it reduces the rate of hospitalization by 30%, but there is a lot of controversy regarding the safety of this drug. So recently ICMR has also objected regarding the use of this drug in younger populations because it can have teratogenic effects as well as mutagenic effects. So so your doctor will decide which chunk of population will need this molnupiravir. So finally, the most effective form of treatment, most effective form of prevention will be COVID appropriate behavior. Please don't go in gatherings. Please wear a mask, avoid gatherings, sanitize yourself, follow COVID appropriate behavior. This will be the best form of prevention and this will be the best form of treatment. Thank you everyone.